let's talk about the choroidal hyperreflective dots. We have, I think you guys yesterday discussed quite a bit about the retinal hyperreflective spots, which are seen commonly in diabetic macular edema, AMD, visual venous occlusions, and they have been shown to be correlated with visual acuity as well as retinal sensitivity. The origin is still supposedly inflammatory. We have not yet decided to change the treatment approach when we see these retinal hyperreflective dots. So I just thought that let's take you a little bit more deeper, and you will see what I'm going to talk is primarily these hyperreflective dots which we are seeing in the choroidal scans, as you can see very well on these, this scan particularly with the help of these arrows. They have been seen in AMD, as you can see here, in the choroidal area as well as in PCV. And the bottommost picture is of a patient with toxoplasma scar, where you can see these dots are much more predominantly seen in the inner part of the choroid. There is some literature available in terms of choroidal hyperreflective foci in Stargardt's, where they reported that these hyperreflective foci were more common on the inner part of the choroid, and they did correlate with the disease severity in terms of retinal atrophy and decline in vision and disease duration. However, this study did not comment about the exact number of spots, and they did not have as such correlation in terms of statistics. So we were interested in primarily counting these dots, which is very difficult manually. So we went ahead and did the segmentation which we had reported before, and then we could count these dots, and we applied this in our cohort of Stargardt's at LV Prasad. This is one of our patients of Stargardt's, where you can see that we could count these dots, and this is one of the patients of retinitis pigmentosa, and we did correlate these hyperreflective dots with the choroidal vascularity as shown on the right side bottom. And we found that these hyperreflective dots were correlating with the choroidal vascularity as well as the disease severity in both the diseases. And I was interested in looking at these dots in the CSR cohort, and where you can see that we saw these dots more common in acute CSR. And this paper is, I think, got accepted recently, where you can see that the acute CSR has the inner choroidal part which has more hyperreflective dots, and the chronic CSR cases had overall diffuse hyperreflective dots. So the significance, we are still not sure whether they are inflammatory cells, because now we are accepting that CSR may be somewhere related to the inflammation, and people are now trying to treat CSR with dexamethasone drops. And this could be just a migrated lipofuscin deposits, because this is one of the theories where the lipofuscin is migrating downwards, and this could be that. And they could be possibly associated with the change in choroidal blood flow, and this could be the reason we found the relationship with the choroidal vascularity, and this could be one of the signs of choroidal remodeling what we are experiencing. But when we were doing this calculation and we are trying to establish the thresholding, we saw that very funnily in our normal cohorts also we found these hyperreflective dots. So I'm really not sure that whether they are present or not, but we do see them in the normal eyes as well, and this could be just an imaging artifact. I'm not really sure. So I'll just end this slide for Dr. Talwar, is that will it help in differential diagnosis of the diseases? Will it change the management? Will it predict the prognosis? I don't know. Thank you so much.